Brain fog, anxiety, mood swings, irritability, insomnia. Sound familiar? Menopause isn't just about hot flashes and night sweats. It's also a major player in your brain's functions. In this video, we'll uncover 5 common mental conditions related to menopause and share actionable tips for getting your brain back on track. You definitely want to hear about number 5. Hi, my name is Dr. A. I'm a lifestyle psychiatrist. Suzanne is a patient who has always been in control, sharp-minded, calm, and confident. But as she hit her late 40s, things began to unravel. First, there was the sleepless nights, tossing and turning with racing thoughts. Then came the anxiety. Simple tasks like driving sent her heart racing. Mood swings followed, snapping at her loved ones for no reason. One morning, she stood in her kitchen, lost in a fog, unable to remember her daughter's name. That frightened her. Now, not everyone has such a presentation, but studies show that some mental conditions are related to the onset of perimenopause and menopause. Let's talk about 5 of such mental conditions. Number 1, anxiety. Very commonly, menopausal anxiety presents as generalized anxiety disorder or panic disorder. Symptoms of generalized anxiety disorder may include excessive worry, restlessness, feeling on edge, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance. In cases where anxiety presents as a panic attack, your symptoms may include sweating, palpitations, trembling, shortness of breath, choking sensation, and chest pain. You may also experience nausea, stomach pain, dizziness, numbness, fear of losing control, or even fear of dying. Some people have also described feelings of unreality or being detached from themselves. Some studies show that hormonal changes during menopause, especially fluctuations in estrogen and progesterone, can trigger increased anxiety levels. It is also believed that the fluctuations in estrogen affect brain chemicals like serotonin and GABA, which can contribute to anxiety. Number 2. Mood swings and irritability. Rapid mood changes, irritability, and emotional sensitivity are common due to hormone fluctuations. These mood swings can range from sadness to irritability or even anger. Research shows that estrogen influences serotonin, the brain's feel-good chemical, and its decline during menopause can lead to mood disturbances. A 2018 study found that women experiencing menopause are more prone to mood swings, irritability, and depressive symptoms. Additionally, fluctuations in progesterone, which has calming effects, may exacerbate anxiety and irritability. Life stressors such as aging, family issues, career pressures, and finances can compound mood swings. This can overwhelm family and friends, affecting relationships and daily life. Number 3, brain fog. Cognitive issues like forgetfulness, difficulty concentrating, and mental cloudiness, often referred to as brain fog, are common in perimenopause and menopause. This condition can leave you feeling as if your mind is wrapped in a thick mental haze. This cognitive cloudiness can make even simple tasks seem very difficult. Women often describe brain fog as trying to recall a word that's just out of reach, or feeling like their thoughts are scattered and disorganized. The fluctuations and decline in hormones like estrogen play a key role here. This is because of the interplay between estrogen and other hormones like serotonin and dopamine. A 2020 study published in the Nature Reviews Endocrinology Journal confirmed that menopause-related estrogen decline affects memory and cognitive performance. Number 4, depression. This can feel like a heavy, unshakable shadow that follows you around. It can present with low mood, decreased pleasure, weight changes, sleep difficulties, and sluggishness. Other symptoms are fatigue, feelings of worthlessness, poor concentration, and even thoughts of dying. The hormonal shifts, particularly the decline in estrogen, are key contributors. Estrogen plays a vital role in regulating mood by interacting with serotonin, one of the brain's mood-stabilizing neurotransmitters. This hormonal roller coaster can make you feel as though you're spiraling into a bottomless emotional pit. A 2018 study in JAMA Psychiatry found that women are 2 to 4 times more likely to experience major depressive episodes during perimenopause compared to premenopausal years. Life stresses that commonly occur during this phase, empty nest syndrome, aging parents, and career shifts, add to the burden. You may suddenly feel like the weight of the world becomes too much to bear all at once. Number 5, insomnia. Addressing sleep disturbance is essential because it can worsen the other 4 conditions. Insomnia is among the most common complaints in perimenopause and menopause. It is related to the decline in estrogen and progesterone, as these hormones play a role in regulating sleep. Hot flashes and night sweats, common menopause symptoms, can further disrupt your sleep. Anxiety and mood swings that accompany menopause can also worsen your sleep issues, creating a vicious cycle where sleeplessness fuels emotional distress, and emotional distress in turn keeps sleep at bay. A 2019 study in sleep medicine reviews linked menopause-related insomnia to increased risks of depression and anxiety, reinforcing how crucial sleep is for mental health. Over time, chronic sleep deprivation can leave you feeling tired and mentally drained, making daily life feel like a constant uphill battle. So, how do you manage these mental health conditions? Firstly, you want to follow up with your doctor to see if hormone replacement therapy is right for you. This treatment can resolve many of the symptoms. Also, consider following up with a mental health provider. Counseling using cognitive behavioral therapy is helpful for anxiety, depression, and mood swings. A type of therapy known as CBTI can also help with insomnia. Depending on the severity of your issues, you may require medications such as selective serotonin reuptake inhibitors to help with anxiety and mood. Examples of such medications are Zoloft and Lexapro. Sleep medications like melatonin and trazodone may also be helpful for insomnia. Lifestyle interventions can significantly improve your physical and mental health. Studies show that improved nutrition, exercise, sleep hygiene, and stress management are beneficial. Social connectedness and avoiding or minimizing substances like alcohol and caffeine are also helpful. For more information on natural lifestyle interventions, check out this next video.